It's nice to have everybody here listening and wanting to learn more about pain management and taking care of their own backs. And I have to be careful not to think I'm dictating. I almost said period in there, in the sentence. So one of my great passions has been to try to minimally invasively treat patients' spinal troubles. From the very beginning of my practice in anesthesia, we were working on ways to awaken people more quickly from surgery, to have them in less pain after surgery, and to return them to function quickly. Then as my practice evolved, I really found a lot of people having trouble with their spines and not necessarily getting better very quickly from the interventions done to treat their underlying problem. So I'm very excited about the Vertiflex procedure with the Superion implant because it's a very minimally invasive way to treat somebody's spinal stenosis and keep them going without having to have a larger laminectomy where the muscle is dissected off of the bone, kind of like filleting out a piece of steak and taking the bone away. With this, we can just put a little device in and we can improve somebody's ability to walk further and stand up longer. So it's one tool that we have that I'm very excited about and very glad to have been working with for about the last 6 years, and it's worked out very well for most patients. Do we have the next slide there, Stacy? There we go. So what I hope people can do, and each of you can do if you do have spinal stenosis, is we can keep you going, keep you functioning, so that you don't spend a lot of time convalescing from a procedure or from surgery or a long time suffering with the problem that you have. So we're looking for solutions to keep you going and enjoying life. I think we're ready for the next one. Yeah. So the diagnosis of spinal stenosis really begins with questions that you have to answer for yourselves. When you go walking or stand up, do you start getting more back pain? Do you find yourself grabbing the cart in the parking lot to go into the store? Or do you find that if you're walking in the mall or a store that you're looking for a place to sit down if you don't have a cart to lean on? All these are signs that your spinal canal is narrowed and that you're not getting adequate blood flow to your nerves in your spinal canal. When that happens, the nerves become grumpy and they're telling your brain, hey, sit down, lean over, stop it, quit bothering me. So your nerves are crying out to get nourishment and better blood flow. So the diagnosis initially is one of history, where you have pain when you walk or pain when you stand, and you get better when you sit down or better when you bend over. Or by leaning on the cart when you go into the store, you avoid the symptoms of back pain and pain into your buttocks, or what we would call the saddle area. Can I have the next slide? So there are many options to treat back pain. And believe me, in my nearly 30 years of practice, I've seen and done most of them. Many years ago, we were all excited about spinal fusion to treat back pain, spinal cord stimulation, epidural steroid injections. All those do have a place, and you may have had some or all of these done to yourself. And if they're not getting the job done, you may need to explore other options. And now I think that really the Superion and other minimally invasive decompressive techniques have replaced a lot of these, or changed the place of a lot of these treatments in the armamentarium. So if we have the next slide. So spinal stenosis affects millions of people. It's not really a disease, although we call it that, but really it's what happens when we live long enough to get some arthritis in our back that causes a spinal stenosis. So if you have it, you're one of 14 million Americans with spinal stenosis. Most of us who are over age 60 develop some degree of spinal stenosis, and at some point it often becomes function limiting, and that's when we really believe we should intervene with a procedure and treatment for the spinal stenosis. And if you don't treat the spinal stenosis, you can actually lose function of your legs, your bowel, and your bladder. We don't want to let it progress to that point. So I think one take-home message, if you start to experience the symptoms of pain in your back when you walk and relief when you sit down, you should seek medical advice and assistance and at least be observed and monitored. So the next question we have here is, what is lumbar spinal stenosis? As you can see on the slide, it's when the nerves are pinched and the redness of the nerve root indicates it's being grumpy or that the blood flow or blood supply is being impaired. One analogy I like to use with my patients, if you can remember ever seeing a stick across the little creek where the scum builds up behind it, and then if you lift that stick up or move it, it all washes down the creek very quickly. With the spinal stenosis, the canal is narrowed in such a way that the venous blood, the blood that's already been to the nerve, can't really get away from the nerve and it gets blocked. So the flow of blood backs up, and so that you have the blood that doesn't have a richness of oxygen and has a lot of acid in it from metabolic products, and that causes the nerves to get grumpy. You lean forward. When you lean forward, that increases the cross-sectional area of the spine. It opens up that hole called the neuroforamen where the nerve is coming out, and the venous blood can get away. The nerve then gets nourishment from new capillary blood, and the nerve gets happy and your pain goes away. So that's how we try to treat you with the Superion implant. We have the next slide. So the Vertiflex procedure, which uses the Superion implant, is one where we put a little spacer between the spinous processes, as you can see with the small device on the right side of your screen. And that opens up the spinal canal so that the nerve gets adequate nourishment and it doesn't get grumpy or painful when you go on your walk or when you stand up for a little while. It's an FDA-approved procedure. It goes through a small incision in the middle of your back. It's usually about 1.5 inches long or a little bit less. And it's an outpatient or same-day surgery, and it works very well. And there's a speedy recovery. Most people will go home within an hour of having the procedure completed. So can I have the next slide? I think one point to make is over 10,000 of these procedures have been done, and I haven't done all of those. This is a representation of how the procedure is done. We put a dilator in and we open up the space and then place the implant between the spinous processes and then deploy little wings, and the little wings surround the spinous processes so that the implant stays securely in place. A very elegant procedure, a very elegant implant. So I actually have a little one here. Stacy, can you guys see that all right? And then the implant opens up like this so that it stays between your bones and stays put. But yet it blocks the vertebra from coming together and pinching your nerves. Let's have the next slide. After the procedure, you can expect to be able to stand up straighter and walk further. It may take a little time for your body to adjust to this adjustment in its biomechanics or in your posture. We do ask that you don't participate in any strenuous activities such as tennis or twisting activities like golf for about 6 weeks, and that you limit your lifting to about 10 pounds. What I find in clinical practice is eventually people forget and they carry on with life and then realize, oh, I feel better, and maybe it has or hasn't been 6 weeks. But we do want you to be careful for about 6 weeks. The wound care in my practice is simple. The stitches will be inside your skin and they will dissolve over time. Leave the dressing on for 2 days, and after that, take it off, and then we just have you keep a little bit of antibiotic ointment on the wound until the scab is gone. So there's no staples to remove in our practice. I have the next slide. Can we have the next slide there, Stacy? There we go. So the results are real with the Vertiflex procedure. 9 out of 10 patients are happy and satisfied that they had the procedure done. 85% of the people have a decrease in the use of pain medication. 80% have improvement in their physical function, meaning they can walk further, stand longer, and return to activities of daily living that previously were impaired. And 75% of the people are really happy they had it done even 5 years later. So it's a procedure that has a lot of utility in treating spinal stenosis as we get older without having to have a big surgery that has a long recovery time. And Gloria and Bill, as you can read, are very happy they had it done. Could I have, the next slide? So not everybody has lumbar spinal stenosis that's amenable or likely to benefit from the Vertiflex procedure. So there are other keyhole procedures I do with the endoscope to do an endoscopic decompression or discectomy. So if you don't get immediately better with sitting or leaning forward, research shows that the Vertiflex procedure is probably not for you. But we do have other really micro-invasive techniques that are outpatient surgeries that can decompress your spinal canal and relieve your symptoms. So the take home for you is that we are really trying here at Spinal Therapeutics and Diagnostics to take care of your spinal pathology without having to have big surgeries, without having to have long recovery times, and being able to go home and resume activities very quickly afterward and try to have very, very little morbidity or complication from the procedures. So if you don't exactly fit the Vertiflex procedure, we have other things to offer that can still be very helpful and fit with our mode of practice, which is to return you to function quickly. Can I have the next slide? And then, of course, there's other traditional pain management techniques. We have spinal cord stimulation. So if you have neuropathic pain without nerve compression, stimulators work very well. Radiofrequency ablation can be very effective if you have pain just from the facet joints without nerves being pinched. And again, all these things take a physical examination, and they take into an examination of you with a conversation about where do you hurt, what's your pain like, and what bothers you or what can't you do. And then we try to set some goals with you so that we can treat you so that you can return to function. Have the next slide. This again is another option, which is radio frequency, where we actually destroy the nerves that go to the facet joints to, in a sense, disconnect those painful facet joints from your brain. And the next slide. All right, frequently asked questions. So if you've had other treatments done, are you still a candidate for the Vertiflex procedure? And the answer is possibly. If your spinous processes are still intact, the Vertiflex procedure may be very good for you. If you've had a complete laminectomy, no, it's not. The real simple answer for this question is come on in and see us, and we'll help you understand if it's a good option for you. Does the Vertiflex procedure require a hospital overnight stay? The answer is no. In very select cases, if you have severe medical disease, we might ask you to spend the night for safety's sake, but 99% of the patients who have a Vertiflex procedure go home within an hour after its completion. Is it covered by Medicare and Medicaid? Yes. The Vertiflex procedure is covered by Medicare, and it's a preferred procedure for Medicare. The recovery time, we ask you to limit strenuous activities for about 6 weeks, but almost everybody will be up walking the day of surgery and feeling better. You'll have some back pain from the surgery afterward. That usually resolves in a couple of weeks, if not sooner. Another question is, will I be able to have imaging such as an MRI scan or go through airport security? The answer is yes. The device is made of an alloy that's not magnetic, so it can have MRI scans. And you'll keep a little card in your wallet so that you can show the gate agent if you do trigger the scanner. Does the Vertiflex procedure or the superior implant restrict your movement? The answer is not really. Actually, I've never had a patient complain that their movement was restricted afterward. In the way it's designed, it doesn't affect the motion of the spinal elements, because the spinous processes can have micro movement around the little arms of the Vertiflex implant. And does it relieve pain immediately? In many patients, they'll find that the leg pain and the pain from spinal stenosis is gone right away, but you will have post-surgical pain. That's usually gone in a couple weeks, but sometimes it'll take up to 6 weeks before you get the complete relief of the procedure. I think now it's about time to open up for other questions. Is that what the next slide is, Stacy?
So the next slide, if my computer will cooperate with me, not quite.
I think this is the sales pitch, I guess.
Yeah.
We want to take good care of you all, so you have to decide. And this is where the goal setting comes in our practice. You know, what do you want to do that you're having trouble doing? So do you want to play tennis? You want to swim more? You want to go hiking, dancing, out with friends, shopping? You want to do more in the garden? You want to stand long enough to cook a meal or cook a gourmet meal, play golf, or even get out and just walk your dog? So you'll have to ask yourself, what do you want to do that you have trouble doing now because of your spinal stenosis or your back pain? And then we will do our best to relieve the pain so that you can get back to the activities of life that you want to enjoy. But again, it's really about taking care of you, the patient, and figuring out how to help you best and do it with the least risk possible.
All right.
So if you're watching this program and you feel like you need to be seen or would like to be evaluated for the Vertiflex procedure or any back pain treatments, feel free to give us a call, 765-213-6373. And you don't need a referral if you've listened to this program, but do mention that you listened to the program when you call for an appointment. So if you mentioned it, then we'll get you in and evaluate you in our practice. So, and you can call either the Muncie office or you could call the Fisher's office, which is 317-776-4844. And now I think we open up for questions. Is that correct?
That is correct. Thank you, Dr. Coleman.